Hypertension is an increase in blood pressure. We can interrelate the patient's hypertension to the risk of cardiovascular diseases such as coronary artery disease, heart failure as mentioned earlier, ischemic attack, and chronic kidney disease. Patients' obesity and aging are also risk factors for hypertension. Excessive alcohol consumption can also lead to hypertension, but the patient stated that he has been sober for the last 30 years. Next, the patient has dyslipidemia, which is an abnormal blood lipid levels, including high total low-density lipoprotein and triglyceride levels, as well as low high-density lipoprotein levels. This may be related to the patient's cardiovascular disease by causing atherosclerosis, which may lead to heart attack. And atherosclerosis is a narrowing of the arteries due to lipid formation. Hepatic cirrhosis or liver cirrhosis is when a liver is unable to function properly because of damage to the cells, most likely due to overconsumption of alcohol. Patient drank for more than 30 years. In cirrhotic liver, we get fibrosis and nodule formation. The portal vein that drains blood into the liver is not effective because of fibrosis, so there is backflow due to the buildup of pressure. Signs and symptoms in abdomen findings include ascites, and it is an accumulation of fluid in the abdomen, and this was one of the patient's issues. The complication of cirrhosis is a result of mainly portal hypertension, which is, as mentioned earlier, due to the fibrosis of the liver, high in pressure. Quick note, the ulcer on coccyx may be due to prolonged bed rest. Next, gastroesophageal reflux disease or GERD can cause heartburn by backflow of gastric acid and other gastric contents into the esophagus. When the lower gastroesophageal sphincter is compromised, GERD results. One of those factors include things like decreased esophageal sphincter tone, which may be due to alcohol consumption. Lastly, I will talk about the patient's mental health status. We can say that mental health is a state of psychological well-being. Depression and suicidal thoughts can impact the patient's mental health, which can lead to low self-esteem and coping mechanism.